All right, we can get started. Oh, we got a hand raised. Okay, Adina, do you have a question?
Well, you can post it either in the chat to all of us or in the Q&A.
Why isn't people post in the chat? Let me get started with my welcome spiel, and then we'll get into it. It's going to be light, casual, fun as it can be, and it's a safe space for everyone, right, Erin?
Yes.
Okay. So, hi everybody and welcome to Conversations on Cancer with Jasper Health. Jasper is a supportive care company providing one-on-one support sessions to people with cancer and their families. We focus on everything your oncologist probably doesn't, like emotional support, navigating cancer, nutritional and physical wellness, among several other personalized things. Erin and I are oncology social workers with over 20 years of experience between us. We will be discussing unique challenges that come with a cancer diagnosis. The topics are often times too uncomfortable to discuss with your medical team, friends, or family. So today we will specifically be discussing the difficulties that come along with the very hot summer, especially if you're in Florida like Erin and I. We'll be talking about the sun, the sweat, and everything in between. We're going to go over some common concerns and questions we have heard throughout our career, as well as the strategies we have recommended to our patients that can help you. As always, we encourage you to sign up for Jasper Health to get your own one-on-one support to address your specific concerns and get connected with your own personalized care navigator. So I will go ahead and introduce myself, and then I will let Erin introduce herself. I talk with my hands. I can try not to. My name is Lindsay. I am a certified oncology social worker. I've been with Jasper for about 2 years, and prior to Jasper, I was with Cleveland Clinic for about 7 years as an oncology social worker. Before that, I was with Gilda's Club for about 2 years, providing supportive counseling for anybody touched by cancer. So I've been in the space of oncology for about 10 years, and it is where my passion lies. So I'm very excited to be here today to get into it and talk about it. Erin?
And my name's Erin, and I also am in Florida, the northeast part of the state. I have been a social worker for 18 years, and I have 5 years experience in oncology, half in pediatrics, half in adults, with a year of hospice. I've done a lot of counseling and different things, and I am really happy to be here with you today. I joined Jasper a few months ago and just feel honored to be able to provide support for folks going through cancer. It's a privilege to meet with my members one-on-one and hear their stories, and it's a privilege to get to talk to you all today about the hot, hot summer.
Yeah, so let's get into it. It's
Yeah,
hot.
really hot already.
Especially in Florida, but I'm sure in other states as well. If you're in Florida, you're dealing with the humidity. So what does that mean for somebody going through cancer? I think when you're going through cancer in different climates other than summer, different seasons, you can already deal with the side effect of increased sweatiness, increased hot, sometimes cold as well. It goes the other way. But being in the summer weather definitely makes it 100 times worse, right? So, what can we do and what do we tell our patients to help get them through things that they wouldn't think about? That's what I want to talk about. The things that when you go to the doctor, you know, a lot of times we tell our patients bring a pad with information you want to ask, but you get that kind of white coat syndrome. You get scared, you feel rushed out, you don't get to ask all your questions. Or you and I have talked about a lot of patients have mentioned that they forget. Like you heard things a long time ago, and you were just telling me about a situation the other day, Erin. I don't know if you want to bring that up. That was a really
Yeah,
good.
I ran into a friend of mine whose husband has cancer, and he started on his oral chemo like 6 months ago. So it was in December, and I'm sure that he got like the full education about what to be careful for and how to be careful with the sun. But then, like, fast forward 6 months later, he goes fishing with his dad and gets completely sunburnt to a crisp and dehydrated. And so she was telling me, she's like, we just didn't think about it. And so even if your doctor or your, nurse navigator did the education with you, it's like that's when you're in that shock mode is you can't always absorb it. So we want to bring attention back to some of the summer things and how important sunscreen and protective clothing is, like how to stay cool, things like that.
And what we recommend to patients. That's a really good example, especially people on oral chemo don't realize you still have side effects and sensitivities, whether you're getting chemotherapy, IV chemotherapy treatment, radiation treatment, a lot of skin sensitivities. So how do you prepare for the summer? Well, obviously, we always say sunscreen, right? But some people might not be able to put sunscreen on their skin if they're too sensitive. If they're dealing with a rash from radiation, the last thing you want to do is then put topical sunscreen on it to irritate it more. But that doesn't mean you necessarily have to miss out. So we could say wear protective clothing. They have specific rash guard shirts, specific clothing that has it built in. My favorite is the big brimmed hat, which I couldn't think of the name for it. So what do we call it? The sombrero
The
type hat.
sombrero.
That covers your whole face, your neck. So if, head and neck cancers, it's very irritated in this area and you don't want to get sun to it, but you want to go outside. Wear the big sun hat. I know it's not a sombrero, but if you have one, you can wear that too. If you got it, rock it. But definitely a hat. There are some specific brands that cater to cancer patients, like Hale and Hush is a really big one, and nobody's really heard of that unless you have an oncology esthetician telling you about it, because that's how I heard about it. I don't even know if you've heard about it, Erin. Hale and Hush. It's really big. I even got it for myself because it's for sensitive skin, and it was made for people going through treatment. They have, as sunscreen. They also have lotions, so that's great for the summer. Um, Other things that we've talked about. So, with it being hot out, what are a lot of activities to do in the summer?
Everything's outside. We talk, and
Outside.
also it's like wedding season, like barbecues, July 4th, graduations. There's so much going on. And so we wanted to like touch on some of those things too.
You don't want to miss out on it all. You want to go, but you don't want to be uncomfortable and you don't want to put yourself in a situation that um, you could become dehydrated or uncomfortable. So, ways to go about that: being prepared for those situations. But how do you prepare? So, what we talk to our members are about is, you can still attend all those things. You can have a conversation with the host before. If you're going to a barbecue, explain, beforehand if you're comfortable enough, saying, I might not be able to sit outside the whole time. I'm going to have to go into the air conditioning. Like, advocate for yourself. That's a big thing. We're big on advocating. This is your time where it's about you. So verbalize it, communicate, tell the people you're going with that you might not be able to stay the whole time. Take your own car. Don't feel like you have to leave. That's a good one. Um, what are some other ones we've talked about?
Yeah. I mean, just feeling, I think really making a plan, right? And really trusting yourself. Like if you don't feel up to it, that's okay too. And really allowing yourself to turn down if you don't feel up to it or don't want to do it. I know we talked about the small talk at all the parties. Like sometimes that can be hard to like everyone's like, "Oh, what are you doing this summer?" And you're like, "Oh, I'm going through cancer treatment."
Right.
And have scans in a month or whatever, and that's all I can think about. So sometimes small talk can be hard, so you can kind of plan and prepare, maybe have your friend or partner have a hand signal or like a
Yes, that's a big one, a hand
need
signal.
rescuing from a conversation or
I love
because
that.
it's good, it is good to see people and to, have your community around you and friends and um
You don't want to totally isolate, and it's harder during the summer because of the weather, I think. So it's easier to isolate because you'll be like, it's too hot, I don't want to sweat. So then you isolate and then it just becomes bad for your mental well-being and your emotional health. And that's why having your personalized navigator is great to talk to. Like you were saying, like, what are you going to talk to in these conversations? well, you want to talk about what you're going through, but that's what you can talk to your navigator about. And then when you go to these parties, if someone asks, you just have something you always say, something you're comfortable saying. It's like, oh, I have a few things planned. You don't have to give them the details. It's not their business if you don't want to say it.
Yeah,
You don't have to tell them everything. You can be honest, but you don't have to be. You get to write your own script. You get to do what you want to do. You don't have to make excuses. You don't have to apologize. This is your time, and give yourself grace with it. Don't feel bad about it, right?
absolutely.
Don't feel like you have to say anything. And I always, a lot of times, when people go through treatment, not in the summer, a lot of side effects come with treatment, right? A big common one is diarrhea is a common one. I have colorectal patients or even other types of diagnoses. Sometimes they're afraid to go out all throughout the year because they're worried they might have an accident. So I was like, all right, let's have a plan so you can go out and not be isolated. So what is that plan? That's going to include bringing a change of clothes in case you do have an accident. Always know where the nearest bathroom is. Quickly go, change your clothes. Do the same for the summer. What are people most worried about in the summer? The excessive sweating. They're embarrassed. They're going to have like the sweat marks.
Mm.
You're going to sweat in places you don't want to sweat. Even without chemo, people are just sweaters. Add the chemo, and it's like a lot of sweating. So bring extra clothing with you. If you can keep it in your purse, keep it in your car. And then
Yeah.
that way you don't have to worry and have that anxiety that you're going to see the sweating. Because sometimes you can't wear the deodorant. Um, it might be too
Whether
irritating.
it's agitating, like if you're
Mhm.
getting radiation.
Yeah.
Yeah, absolutely.
And there's we've talked about there's special
Shaving. Yeah,
there's
or just, yes,
things.
the wipes.
Yeah, no, people don't
Personal
want to
care
talk about,
wipes,
huh?
Lindsay. Personal care wipes.
Personal care wipes, but I'm gonna go ahead and say there's certain brands that people favor, and I'm gonna plug it because I think a lot of people could benefit from it. My husband's a huge fan. They're called Dude Wipes, and he tries to give them to everybody, even when we have company. He's like, I left some Dude Wipes in there. So So bring some Dude Wipes with you, but Aquaphor is a good thing for chafing, and the
Hmm.
doctors recommend it. Also, anything we recommend, please talk to your oncologist about first because there may
Absolutely.
be fragrances in it, but I will say Aquaphor doesn't have any fragrance. It is safe. Anything from Hale and Hush, I completely feel comfortable saying. But you were even saying Monistat has something for women for chafing, and
Mhm,
that's something people
mhm.
may not know or feel comfortable going to their male oncologist and being like, listen, it's hot out.
Yeah.
What can I do?
My
Monistat.
thighs are rubbing together.
Yeah. What can I do? Throw some Monistat on it. Throw some Aquaphor on it. Grab some Dude Wipes. That's okay. Talk
Yes,
about it.
absolutely. Absolutely.
That's what we can talk about. So those are some ways to prepare for, if you're going to be in a hot situation. There's also, um, we found a pretty fancy hat that's
Yeah.
better than sombrero.
I think it's going viral on the socials. I don't know. I'm not that deep into it, but this hat is amazing.
Yeah, it's got built-in fans. So if anyone wants to look it up on Amazon, I definitely highly recommend it. Um,
Absolutely.
so, and then if we definitely dehydration, if you want to talk some about dehydration,
Yeah,
Aaron.
so let's talk about like getting prepared with water. And I see we got a question too, so I
Oh,
don't know.
right.
We could take a look at that. So yeah, always, I mean, I don't know, I don't go anywhere without water anymore. I joke with like people my age. I'm like, my kids, I don't send them out with water without a bottle of water, but I'm like, I don't remember always having a water bottle. But now it seems like it's fine. It's trendy. You can carry your water bottle. You can get a Stanley cup. You can accessorize your water bottles. It's a whole thing, but um, definitely taking water. If you don't like the taste of water, you can flavor your waters with different little packets and
Squirts,
yes, the
the
squirt
flavor
things
squirts.
and snacking on fruit is a great way to stay hydrated. It's watermelon season. Now, of course, if you're on chemo, and need to follow a neutropenic diet, make sure you're washing and cutting all your fruits, not buying pre-cut fruits,
The
things like
BOGOs. Stay away from the BOGOs.
oh, the BOGOs. I don't know if anybody else has Publix, but BOGO is my jam.
But
And
it's buy one get one on pre-cut. But even if you're not neutropenic, it's still good to get your own fruit so you can wash it with an antimicrobial. Cut it yourself because you don't know. if they're
Right.
cross-contaminating back there in public. So, and it's cheaper. It's cheaper to buy the bigger fruit.
It is.
And so, yeah, watermelon's a big one. Hydrated, throw some water in your fanny pack. Fanny packs are back. They're in. They're
Okay.
huge. Throw water
Yes.
in it. So this question's a great one. She once says, or somebody wrote, can we discuss unique challenges faced by young cancer patients, juggling work, maybe even peak earning years and family responsibilities, and friendships where people don't get it? Comments like, you're so young for cancer.
Yeah.
That's a big one.
Let's
We can
let's
absolutely
let's
talk about
break
that.
that down because that
Yeah.
was the yeah.
Do you have that pulled up?
No, I don't. Where is it?
Okay. Well, we can start it off with, um, you know, there are people don't realize the percentage of people getting diagnosed with cancer, it's younger ages now, and it is not talked about a lot. So it is isolating in that. Um, and so when I think that's a very, I hear that a lot when you tell someone that they got diagnosis, they're so young. But when you say that to somebody who has the cancer, they're like, thanks, I know. Like, what do you respond to that, right? So
Yeah.
it's to
Yeah.
kind of have a response going into it. Uh,
Absolutely.
because I don't think people who say that always, they're not ill intent. They don't have, like, they don't mean harm. They just don't know what to say. And I think they're shocked as well. So having a comment, she said, I'm just like, okay.
Right.
But you can say that, you can say whatever you want. This is
Yeah.
the journey.
Yeah.
You find something, and you can be honest. And this is a great time to educate and bring awareness. And it's not your place, but you can, right? Your response can be like, I am young and I'm dealing with cancer. Thank you very much. I don't
Right.
know how
Right.
nice that is, but
Or like the other piece, right? Like, okay, you're 25 and you finished treatment 6 months ago. Well, you should be over it. Let's go. We're going to the beach.
oh,
We're going on a trip. Like, you're totally fine, but you're
yeah,
not yet. You're still like got brain fog and you're tired and um
late,
yeah,
like the side effects. If you have surgery, you're still dealing with, stuff from the surgery. A lot, some people lose limbs, some people have permanent effects from surgery. Um, and cancer does change you permanently. So she wrote, I don't know if you could see it, Aaron.
yeah, I got it
No,
put up.
no, feel like cancer changes you permanently. It can change you, but it doesn't have to be a negative thing. And you're going to have your journey and you're going to go through the different motions where you're angry and you're in denial, anger, frustration, why me? Absolutely normal. But it can change you for the better because you made it through and now you know what's important. You know who's important. You know who your real friends are. You know who you can count on. But I wanted to go back because she was kind of like, how do you handle the family responsibilities and everything? This is when you delegate. Now's your time to ask for help. And it's okay to not be okay. And I think that's what a lot of people don't realize. They feel like they have to juggle it all and they don't, right?
Right. It's so hard to get to that place, to ask for help. But I think help can be such a sacred word where um, but knowing what you need sometimes is hard and knowing how to communicate what you need. Sometimes you're so overwhelmed and you don't even realize that there's something you need or maybe your family lives far away. Um, and so there's a lot to juggle but we can help you find resources and help you connect with like other folks that are going through this and support groups are a great space where you can get ideas um, for how to talk to people about these types of issues. But the young adult cancer population is very unique. I mean, it really you guys have such challenging, I think you got social media, right? All your peers are like looks like everybody's life is so great and perfect. And then, you're feeling, I don't know, I talked to someone recently and they said, I survived, I got through it. And now I don't feel good. And I wasn't expecting to not feel good. And so like, what's the point? Not, I mean, she just was like, it's not, I want to live, I want to be alive, but I like, it's really hard living with the after effects and how it changes you. You almost have to get to know yourself. like
It's a
get
new
to know.
normal, a new you.
Hmm. Hmm.
It's reprioritizing. And then a lot of people I talk to, they're fine, right? They're like checking in, they're fine during, and then because they're go, 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 doctor's appointments, they're talking to people. And then after, once they complete it, they're like, what did I just go through? And that's when it hits them. And then that's when they're dealing with the emotional side effects of like, oh my goodness, I just went through this. I just survived this. And now what do I do? I'm different. I'm changed. So having a navigator to help you through that, to talk to you, because it's going to be an emotional roller coaster. Your weekly, it could change how you feel. Having someone personalized to talk to get you through the different emotions is very beneficial. And the support groups, I like that for the young adult population, talking to peers, because talking to a family member is one thing, talking to a friend is another thing, even talking to us, but talking to somebody else around the same age, same diagnosis, who's been through some similar treatment is a whole different level of support. So I always encourage support groups and peer support, because the more support, the better. Um,
Yeah, Adina is, I love all the comments.
I
And
know she's really helping out. I mean, we're getting off summer topics, but this is fine.
no, and I
It's
think summer can bring up, it can bring up maybe, and even like, I think during the season, you can be like, oh, last year, this time, just every season brings up different challenges. And
fine.
um, you know, maybe your kid, you want to give if you're a parent and you want to give your kids like, feel pressure to give them memories or like do things with them, but you don't feel up to it. There's just talking about all just feeling pulled in so many different directions, plus processing your trauma. And
Yeah.
it's traumatic.
Very traumatic. And that's what people don't realize. And then I think friends and family don't realize the post trauma, the PTSD, the
No.
after.
And friends and family want to fix you.
Right.
So they like, even though like I'm trained in trauma therapies, like I can't, like if I have a family member who's going through something like that, I want to fix it for them. I can't just like hold space. Like, um, and so and then or if like they're a different generation, like pull up the bootstraps, come on, you got this, like just move on, so you got all these like messages coming at you about how you're supposed to be coping, what you're supposed to be doing. Plus we can beat ourselves up too, right? Like we
Oh, sure.
think,
We're our worst critics. We're
yeah.
hard on ourselves. But I think that's where it comes to, it's okay to be a little bit blunt right now and to tell people exactly what you need. People want to help, people don't know what to say. Or if somebody says something to you, and I've had this happen with patients where it was just like, oh, that didn't help me and that kind of upset me. Verbalize that. Be like, I know you meant well, but let me explain to you why this comment doesn't help me and I don't need you to continue to say it. Or if you do want to help, this is what you can do.
Mhm.
Because a lot of people who don't, not many people know about cancer or dealing with these types of traumas. They say things like, you'll get through this, this too shall pass, those things, but those are pretty hard to hear when you're going through it. They don't always help. So, yeah, and with the younger population for Adina, I don't know if I'm saying it right. The summers can be really hard because like that age group, they want to go to the beach and have fun. And if you feel like you can't, say we talked a little bit, body image. Oh, I
Mhm.
said it correctly. Adina. Um, Body image with social media, with the summer, going to the beach, pool parties, just after having surgeries, having bandages, that's going to be isolating and make you self-conscious, right?
Mhm.
So what can you do? You can wear certain clothing. You
Yeah.
can, there are a few different things
Did you mention breast surgery too? Like, yeah, like, um, oh, medical tattooing.
well,
Nice.
tattooing, definitely. We should have
I like that.
our,
Like claim your body as your own. Like I
yeah.
love claim the scar. Yeah, a lot of folks do that. I think those turn out really cool. Of course, talk to your doctor about it because,
Please, we're not encouraging you to go get a tattoo. You definitely can't get tattoos if you're on treatment. You must talk to your doctor about it, please. But when you are cleared, you do you. Tattoos are great. And the emotional health, which is what we've been talking about a lot, the isolation,
Yeah.
feeling left out, really any age. Um, I
Mhm.
think that's kind of something that you go through. Um, you can't do your typical traditional summer activities or maybe the vacation. So it has to change a little bit.
Or all your extra money went to medical bills.
Yes. And how there's nothing left for vacation. Um,
Yeah.
and
Yeah,
so
feeling like you're missing out, you can't travel, know, maybe you have treatment scheduled, you can't go to that friend's wedding that you wanted to go to. Um, it's graduation season, just feeling like, what I think is hard too is like you don't know how you're going to feel. So, like not knowing if you can say yes, right? Am I going to feel up to it or should I just say no? Because you don't want to cancel last minute on somebody. So really being aware of that might be a hesitation, but kind of just knowing that the people that are, going to be okay with you canceling last minute or changing plans
yeah.
to, you know,
Let
movie
them
on the
know. Just be like, I want to come, but I have to be honest, I don't know how I'm going to be feeling that week. So I'm going to have to let you know last minute. I feel like if you tell them beforehand, that's okay. And if they have a problem with it, then you shouldn't have them in your life anyway. No, no, don't not be friends with people. But you want people who support you and understand and encourage and can help get you through this. And some people it might be hard for, and you might have to distance yourself from toxic people during this. We've talked about that a lot. Doesn't mean it's permanent, but right now you have to surround yourself with the right people, and the right people will understand that you might need to make last minute decisions, or you might cancel last minute. You might not feel well. It might be too hot of a day out. Uh, Another good thing, another good tip for people for like weddings, especially outdoor weddings. There's not many outdoor in Florida in the summer, but having an umbrella, I know people think umbrella for rain, but you can have the umbrella for shade. Like take an umbrella with you everywhere.
they make them like with like they're sun protective, like they have some, I don't know, something on them.
Yeah, and then going
Have
to the
one.
pool, if you aren't comfortable going in the pool, put your feet in. It'll cool you off. You feel like you're partaking in it, sit on the edge. If you just had surgery, you might not be able to submerge yourself in water, but you can still attend, put your feet in and hold the umbrella, or there might be a shaded area. So there's ways that you can get around participating if you still want to. You just have to plan it out.
Right. Yeah.
Yeah.
That's really good. Having a plan.
I think there's another
Any
question.
other questions?
Yes. Can you make a list of recommendations and send it to us in an email, please? Like for hats, sunscreen, deodorants, and wipes. We have a lot of great recommendations.
Yes.
We will
That's a great
definitely,
idea. We can send that out for sure. I
absolutely.
thought I thought someone might ask that um when we were preparing. So yeah, we can do that.
I
It's a
think that the fan hat will really take off. A
y'all, this fan hat is so cool. I want one.
hat and the dude wipes. It's
It
going.
has these like solar panels and then I don't know, that powers the little fans that blow on you.
And the hat covers you. So you're
Yes.
shaded with a fan, so you don't have to hold it. You can just go about it. It's really great. It's on Amazon. We'll definitely send you the link. As well as deodorants. I will say, if you just off for any deodorants you want, non-fragrance. Fragrance is always going to be irritating. So stay away from anything with fragrance. If you can't do, some are expensive. Hale and Hush might be a little pricey, but if you can go to, we have Publix in Florida. I don't know what supermarkets or in other states, but any of your supermarkets, just find a lotion, look at the ingredients, and make sure it says it doesn't say fragrance because sometimes they'll sneak that in and it can really irritate your skin. So you always want to read the ingredients on anything, any lotions you're going to put on your body, any sunscreens you're going to put on your body. Always read the ingredients because they'll sneak the fragrance in there. Um, so that's super important. And I would say nothing less than what's the recommended? Is it, I should know this. It's like 30 or 50. Because I feel like I read 75 isn't real. Sorry. But I think 50 is like the
Highest. But we'll
highest.
send out for everyone that's here, and I think everyone that's registered can get an email too, and we can send out some brands.
Yeah, and we also, in our Jasper app and on the Jasper website, we have articles, which are amazing. Our articles cover an array of topics, and a lot of them talk about skin. They have recommendations in them. They talk about feeling isolated, emotional wellness. So definitely please check out our website and our app and our articles, as well as we will email recommendations. Let's see. Any other questions? Anything else you feel important to talk about?
We missed.
Summer, I think we covered it. We
Mhm.
covered the drinking, really important. I mean, in general, when you're on treatment, you can dehydrate easily. The sun's gonna make it that much worse. And when you wake up, you forget to drink. We talked about this. It's hard to remember. Put an alarm on your phone.
Right.
Literally throughout the day, set alarms, drink, drink.
My
It's
water right here.
Yeah, you can get the trendy Stanley Cup if you want to be with all the youngins. They on Amazon, super cheap, they sell like this huge, it looks like a big gallon thing. I don't know, it's got pretty covers. Carry that around with you all day and drink from it. Uh, but I think if you have a hard time remembering to drink, um, put a reminder on your phone. It's too much to remember between your appointments and your medications, and you have to remember to eat. But you definitely have to remember to hydrate. So definitely, I think I put alarms on my phone for everything. And I think that's very helpful, as well as the snacks and electrolytes.
Hmm.
We talk about drinks with electrolytes in it?
We did not.
You can drink water with electrolytes. That's helpful.
Mhm.
If you're really feeling dehydrated, sometimes like Pedialyte, even though it's for kids, you can drink that, and that your Powerade's really good. Gatorade for electrolytes.
And yeah, there's several grocery store drinks. I think that they watch the sugar, but
Yeah, definitely. So definitely talk to your doctor first. I don't want you drinking like 5 Gatorades and then your sugar shoots up. Um, all right. Well, I think that brings us to the end of our summer hot, sweaty, dehydrated conversation. Uh, we hope you found these tips helpful. I don't know if you have anything else to add, Erin.
yeah, just if you want to continue any of these types of conversations, we'd be happy to talk with anybody one-on-one. Reach out to us. If you have questions or topics you want us to have a conversation about in the future, email them to us at wecare@hellojasper.com. Obviously, you can connect with one of the care navigators. Um, but it's such a privilege. Care navigation is we're stepping into a space where we know folks really need extra support. There's just not enough at the cancer centers. And so we want you to know we're here for you, and it really can help to have someone to talk to about all these, you know, off the wall questions or things that come up as part of cancer that you don't always think of. And it can really reduce your stress levels, really make you feel like you have someone in your corner and feel stronger and more empowered to face the hot, sweaty summer. So,
And the
yeah.
rest of the seasons.
And what?
And the rest of the seasons.
Yes, every season.
Every season we are here for you. So yeah, you can also call us at 929-552-3904 to get connected with a navigator and set up with sessions and learn more about our services. So thank you so much for joining us,
Yes.
and we'll see you again soon.
Thanks, everybody.
Bye.